Psychiatric rehabilitation, also known as psychosocial rehabilitation, and sometimes simplified to psych rehab by providers, is the process of restoration of community functioning and well-being of an individual diagnosed in mental health, a mental or emotional disorder, and who may be considered to have a psychiatric disability. Society affects the psychology of an individual by setting a number of rules, expectations and laws. Psychiatric rehabilitation work is undertaken by rehabilitation counselors, licensed professional counselors. Psych rehab consultants are specialists, university-level masters and PhD levels, classes of related disciplines in mental health and community support, or allied health workers represented in the new direct support professional workforce in the United States. These workers seek to effect changes in a person's environment and in a person's ability to deal with his/her environment, so as to facilitate improvement in symptoms of personal distress and life outcomes. These services often combine pharmacologic treatment, independent living and social skills training, psychological support to clients and their families, housing, vocational rehabilitation and employment, social support and network enhancement, and access to leisure activities. There is often a focus on challenging stigma and prejudice to enable social inclusion, on working collaboratively in order to empower clients, and sometimes on a goal of full recovery. The latter is now widely known as the recovery approach, a model. Recovery is a process rather than an outcome. It is a personal journey that is about the rediscovery of self in the process of learning to live with the debilitations of the illness rather than being defined by illness, with hope, planning and community engagement. Yet new in these fields is a person-centered approach to recovery and client-centered therapy based upon Carl Rogers and user service direction. Definition: psychiatric rehabilitation is not a practice but a field of academic study or discipline, similar to social work or political science. Other definitions may place it as a specialty of community rehabilitation or physical medicine and rehabilitation. It is aligned with the community support development of the National Institute on Mental Health, begun in the 1970s, and is marked by a rigorous tradition of research, training and technical assistance, and information dissemination regarding a critical population group in the U.S. and worldwide. The field is responsible for developing and testing new models of community service for this population group. The Psychiatric Rehabilitation Association provides this definition of psychiatric rehabilitation. Psychiatric rehabilitation promotes recovery, full community integration, and improved quality of life for persons who have been diagnosed with any mental health condition that seriously impairs their ability to lead meaningful lives. Psychiatric rehabilitation services are collaborative, person-directed and individualized. These services are an essential element of the healthcare and human services spectrum, and should be evidence-based. They focus on helping individuals develop skills and access resources needed to increase the capacity to be successful and satisfied in the living, working, learning, and social environments of their choice. History: for the 1960s and 1970s, the process of deinstitutionalization meant that many more individuals with mental health problems were able to live in their communities rather than being confined to mental institutions. Medication and psychotherapy were the two major treatment approaches, with little attention given to supporting and facilitating daily functioning and social interaction. Therapeutic interventions often had little impact on daily living, socialization and work opportunities. There were often barriers to social inclusion in the form of stigma and prejudice. Psychiatric rehabilitation work emerged with the aim of helping the community integration and independence of individuals with mental health problems. Psychiatric rehabilitation and psychosocial rehabilitation became used interchangeably as terms for the same practice. These approaches may merge with a conflict with approaches based in the psychiatric survivors movement, including the concept of user-controlled personal assistance services. In the 1980s, the U.S. Department of Education, National Institute on Disability Research and Rehabilitation, revised the Rehabilitation Research and Training Center program to meet the new needs in the community of special population groups. A priority center, published in the Federal Register, was the Rehabilitation Research and Training Center in Psychiatric Disabilities, which remains a priority today to provide nationwide assistance, and serve as flagship center internationally. Around 2005, the professional organization International Association of Psychosocial Rehabilitation Services changed its name to United States Psychiatric Rehabilitation Association, and the trend is toward the use of psychiatric rehabilitation academic discipline. In 2012, Temple University was funded in the field of psychiatric disabilities for a national center with the National Institute on Disability and Rehabilitation Research. United States Department of Education, having this population group as a priority. Boston University's Center on Psychiatric Rehabilitation's director is president-elect of the NAARTC program, and Boston University College of Health and Rehabilitation Sciences awards a Rehabilitation Science Doctor of Science degree in the field in which it awards no separate mental health specialty degree. Master program in Psychiatric Rehabilitation was part of a MA degree in Rehabilitation Counseling in the School of Education, Syracuse University, and courses were funded in part through the Federal Rehabilitation Research and Training Program of the U.S., now part of National Institute on Disability, Independent Living and Rehabilitation Research. Theory. The theoretical base for psychosocial then psychiatric rehabilitation is community support theory as the foundational theory. It is aligned with integration and community integration theories, psychosocial theories, and the rehabilitation and educational paradigms. Its fluid nature is due to variability in development and integration into other essential fields such as family support theories, which has already developed its own evidence-based parent education models. The concept of psychiatric rehabilitation is associated with the field of community rehabilitation and later on social psychiatry, and is not based on a medical model of disability of the concept of mental illness, which is often associated with the words mental health. However, it can also incorporate elements of a social model of disability as part of progressive professional community field. The academic field developed concurrently with the formation of new mental health agencies in the U.S., now often offering supported housing services. The Journal of Psychosocial Rehabilitation, then renamed the Journal of Psychiatric Rehabilitation, traces the development of the field over a period of several decades. The academic discipline psychiatric rehabilitation has contributed new models of services such as supported education, has cross-validated models from other fields, has developed the first university-based community living models for populations with severe mental illness, developed institutional to community training and technical assistance, developed the degree programs at the university levels, offers leadership institutes, and worked collaboratively to expand and upgrade older models such as clubhouses and transitional employment services, among others. Psychiatric rehabilitation was developed and formulated as a new profession of community workers which could assist both in deinstitutionalization and in community development in the U.S. It represents the first master's and Ph.D. classes in the U.S. to specialize in a rehabilitation discipline focused on community versus institutions or campuses. In the U.S., it also represents a movement toward evidence-based practices critical for the development of viable community support services. Psychosocial services, in contrast, have been associated with the term mental health as part of community support movement nationwide since the 1970s, which has an academic and political base. These services, which have roots in education, psychology, and mental health administration, were basic funded services of new community mental health agencies offering community living and professionalized community support since the 1970s. Mental health service agencies are multi-service agencies in the non-profit and voluntary sectors form a critical delivery system for psychosocial services. In the 2000s, a sometimes similar but sometimes alternative approach employs the concept of psychosocial recovery. Psychiatric rehabilitation was promulgated in the U.S. through Boston University's Rehabilitation Research and Training Center on Psychiatric Rehabilitation, led by Dr. William Anthony and Dr. Marianne Farkas, as well as other professors and teachers such as Julianne Racino, Steve Murphy and Bonnie Schultz of Syracuse University, who also support a generic community approach to education. The concept has been integrated with the community support approach, including supported housing, housing and support, recreation, employment and support, culture, gender and class, families and survivors, family support, and community and systems change. Problems experienced by people with psychiatric disabilities are thought to include difficulties understanding or dealing with interpersonal situations, prejudice or bullying from others because they may seem different, problems coping with stress, difficulty concentrating and finding energy and motivation. People leaving psychiatric centers after long-term hospitalizations and outdated practice may also have need to assist with injuries that may have occurred and community integration. Psychiatric rehabilitation is distinct from the concept of independent living and consumer-controlled services which have been written about and promoted by psychiatric survivors. The psychiatric rehabilitation concept is separated from the psychiatric survivor concept in education and training of individuals with psychiatric disorders, in that psychiatric survivors tend to operate services and control funding services. Psychiatric rehabilitation services may include community residential services, workplace accommodations, supported employment or education, social firms, assertive community teams assisting with social service agencies, medication management, housing programs, employment, family issues, coping skills and activities of daily living and socializing. Traditionally, 24-hour service programs were based upon the concept of instrumental and daily living skills as formulated in the World Health Organization definition. Psychiatric rehabilitation is illustrated by agency models which are offered by traditional and non-traditional service providers, and may be considered to be integrated as segregated or transitional living services of Buffalo or transitional living services of Onondaga County, New York. Agencies supporting integration may align with normalization or integration philosophy, as opposed to the older sheltered workshop or daycare models which have been criticized for underpayment of wages at the U.S. congressional level. In the late 2000s, agencies may deliver cross-field best practices, consumer voices, multiple disabilities, training of its own community residential employment, education and support service professionals, rehabilitation outcomes, and management and evaluation of its own services. Core principles of effective psychiatric rehabilitation must include providing hope when the client lacks it, respect for the client wherever they are in the recovery process, empowering the client, teaching the client wellness planning, and emphasizing the importance for the client to develop social support networks. Psychiatric rehabilitation varies by provider and may consist of 8 main areas: psychiatric, health and medical, housing, basic living skills, social, vocational and/or educational, GED classes, televised education, coping skills, motivation, financial planning for own apartment, household grocery, social security, disability, banking accounts, community and legal. As of 2013, it is expected that areas such as supported housing, household management, quality medical plans, advocacy for rights, counseling, and community participation be part of the available package of options for services. Modernization in these fields includes better health care, such as women and men's health, public and private counseling services in mental health, integrated services, new specialized treatments, and understanding of trauma services and mental health. Psychiatric rehabilitation is typically associated with long-term services and supports in the community, including post-secondary education as supported education, educational and professional organizations. Canada. In Canada, psychosocial rehabilitation, readaptation. Psychosocial Canada promotes education, research and knowledge exchange in relation to evidence-based psychosocial rehabilitation and recovery-oriented practices for service providers and those receiving services for mental health challenges. A framework of competencies for service providers was developed and announced at the 2013 Annual National Conference in Winnipeg, Manitoba, United States. Boston University Center for Psychiatric Rehabilitation, United States Psychiatric Rehabilitation Association, Rutgers School of Health-Related Professions, Department of Psychiatric Rehabilitation and Counseling Professions.